officially call this meeting to order. And we will begin with a roll call of the members who are present. And so I'll go ahead and start off at the head of the table. Beginning.
Hector Alanis.
Mr. Alanis.
Sylvia Bruni.
Lupita Ramirez.
David Cash Vasquez.
Mr.
Pancho April.
Thank you so much to the members that are present. We have 5 of 7, so that does establish the quorum. And we will go ahead and move on to our public comments. We do not have any public comments that were shared with us through the City Secretary's office. I will move on to the introduction of the committee members. So this will allow some time for the members to introduce themselves to their fellow committee members, and we'll go ahead and start back off with Mr. Alanis. You want to just say a brief summary about yourself?
Thank you. And if it's okay with you all, I mean, I prefer to be called Hector, and if y'all are comfortable with that, that's fine. If you want to be addressed differently, that's okay too, right? But I feel like, most of us know each other, at some capacity, or in some cases, fairly well. But my name's Hector Alanis, and my wife and I, Sandra Alanis, own the Remax franchise here in town, so I'm in real estate. And so
I'm going to interject really quickly and say that the meeting was started at 12:04 on November 7th.
And I'm Sylvia Bruni, a longtime educator. Currently, yes, I'm serving as the chair of the Webb County Democratic Party, but I will tell you why in particular this particular committee attracted me. I've been a longtime educator. In fact, that's what I consider myself, a teacher. And one of the things that has always concerned me, particularly during the years that I was in the schools, was the fact that our children were predominantly low income. And even today, a good 30% of our population has no access to health care. And that's the primary reason why this particular committee attracted me. And I'm Sylvia. Okay?
I'm Lupita Ramirez. Mainly I'm a business person. I did teach for 5 years at Mary Help, so I love business. I like teaching. And I am a property manager.
Hi everybody, I'm David Cash Vasquez. I'm the Director of Communications and Public Affairs for Gateway Community Health Center. Really quickly, just a quick synopsis of myself. I've spent 20 years in marketing, everything from traditional marketing to digital marketing, so that's my forte, if you will. Right now, the one thing that excites me most about this committee is the fact that Gateway Community Health Center is a fairly qualified health center. In terms of access, that's our mission. Our mission is to create ease of access for everyone for primary health care. So as a primary health care facility, what we do is we offer medical, dental, behavioral health care. Aside from that, our ancillary services continue to grow. We have 2 full pharmacies. Radiology, that includes x-ray, ultrasound, and soon to be mammography. And we accept everybody in 3 counties, Webb, Zapata, Jim Hogg. Whether they have insurance, they don't have insurance, or an ability to pay, we try our best to create access for those folks. And so I'm just happy to be a part of this and glad to see a lot of familiar faces as well.
Oh, I go.
Yes, sir.
Okay, my name is Francis Cullen Averill Jr., even though I'm listed here as Alfonso Averill. I go by Pancho, P-A-N, not P-O, P-A-N-C-H-O. I have been a businessman since the early 70s. I owned a custom brokerage company, sold it back in 2013 when I got cancer. I'm a cancer survivor. And what attracted me to this committee is the fact that as a cancer survivor, I noticed that I didn't think that people had quality care for cancer here in Laredo. I did all my cancer treatments in San Antonio, And it wasn't so much that I did not trust doctors. I just did not think we had the complete infrastructure to manage everything, you know, that I needed. So that's why this attracted me so much, but I do go by Pancho. Nobody, please, do not call me Francis, do not call me Mr. Averill, I go by Pancho, okay?
Thank you, Pancho. Thank you to the thank you to the members for their introductions. If I may kindly request a motion to introduce the city staff that are here at the table.
I'll
A motion. A motion. Can I have a second? Second. Any discussion?
Yeah.
So moved. We'll go ahead and start out at the head of the table.
Well, good afternoon, everyone. My name's Frank Mata, Francisco Mata, but everyone calls me Frank, not Pancho. I am the finance director for the city of Laredo, and I will be your main liaison for the entire bond committee.
Tina Martinez, I'm the director for community development. I won't bore you with my full name, just Tina Martinez is good enough. So I'm the director for community development. I do have a presentation that's gonna be part of this bond referendum subsection that I will be presenting to you all also.
Good afternoon, my name is Jesus Espasa III. I am the budget director. I've been with the city 27 years between the finance and budget department, and I'm here as support staff as well.
Good afternoon. I am Dr. Richard Chamberlain, or legal name Richard Aaron Chamberlain.
Okay, now we're good.
And I am your public health director and also the managing director that oversees the library, the animal care services, and our detox facility. And I am your liaison to this specific committee. And then I will jump right back here and then we'll move down the line.
Good afternoon, Erika Martinez, Assistant Director of Public Health.
Good afternoon, Humberto Delgado, Municipal Housing Manager.
Good afternoon, everyone. Marcela Cervantes, Community Development Assistant Director.
Good afternoon, Jaime Perez, Public Information Specialist here at Health.
Dr. Luis Serra, Preventive Care Services Administrator.
Hi everyone, I'm Mariana Valdez. I'm the administrator for WIC. Everyone calls me Ari. With a Y, please.
Good afternoon, I'm Elisa Luis, Epidemiology Administrator.
Hi, good afternoon, Dr. Montes, Community Health Administrator.
Thank you to the City of Laredo team for your introductions. We will proceed with the agenda to item number 5, which is discussion with possible action on the election of a subcommittee chair and any other matters incident to. So we will go ahead and begin the discussion. Is there any self-nominations for committee chair?
He's the chair, right?
He's sitting in it.
Yeah. You're the chair.
So I was asked to participate in this committee as committee chair, but again, you know, just out of formality, if there's anyone else interested, you know, in serving, of course, you know, we can have that discussion as well. I think it would be the proper thing to do.
I'll move that we
I
give
move
it
that
to
we
you.
give it to you. Yeah, I second, yeah.
So we have a motion
Correct.
from Mr. Alanis to be
Who's the mayor's chair appointee?
Mr. Leanda.
Okay.
Uh-huh.
So he's the chair, so.
So sorry, no. Mayor's appointee is Mr. Alanis, or sorry, Hector, and David and Cash.
Okay, so one of them is going to be the main chair in the main committee.
Okay.
So you can't.
So sorry, then Mr. Alanis can't be. Is it?
Yes.
Is it Mr. Alanis that was the? Let's see. Yes, sorry, Mr. Alanis, you will be the chairman for all subcommittees. So
So then that, you know, voids that motion.
so we will rescind that motion.
But didn't you say that Javier was?
Sorry, that was my error as I'm recalling the communication that was provided to me.
So since Javier's not here, we can nominate him
As committee chair.
as committee chair. Yeah, that's what he gets for not being here.
He would be the subcommittee chair.
I would nominate David, you know, as
Yeah, I
the
was
committee
gonna say,
chair,
I'll
because
throw my name.
it would be difficult to run the meeting without having the chair present, so.
Correct, because we're going to transition to that right now.
Nominate you, David. Tag, you're it.
First,
nominate.
a first
I
motion
second.
and a second. First motion by Mr. Mr. Poncho.
Pancho.
Excuse me, Mr. Pancho.
Here we go
Here we go again. And then a second by Ms. Lupita.
Yes.
All those in favor?
Aye.
Say aye. All- Motion passes. We're gonna transfer it now over to the chair.
Alright. Well, thank you all for your vote of confidence. create some magic and some great things here. Okay, discussion with possible action, moving on to item 6. Discussion with possible action on the election of the subcommittee vice chair and any other matters incident thereto. So, does anybody have, the want to volunteer within them,
Volunteer or voluntold?
or voluntold?
I'll be your sub.
Okay.
Yes.
Yes.
I was gonna put you down for a secretary. I know you take great notes.
Oh, no. That's fine. You can be the secretary.
No, I don't want that.
So I'll be your vice chair.
Alright,
Yeah.
motion?
A motion, motion.
I'll do the second.
Okay.
All those in favor?
Aye.
Alright, motion passes, motion carries. Welcome, Vice Chair.
Thank you.
Alright, moving on to item 7, discussion with possible action on the election of the secretary and any other matters incident thereto.
Do not look at me, I do not take good notes.
Sylvia, I would like to.
Sylvia,
Well, I
she's
would-
an educator.
I'd be happy to, but I'm headed for surgery in a couple of weeks. I don't know how long it's gonna take me.
Is it on your right hand?
I'm not sure that I'll be around. I mean, I know, God willing, I'm gonna be around.
No, it-
Don't
God
tell us
willing,
that.
I'm gonna be around, but
It's
I'm not.
recorded, so you can.
I don't.
Well, on the interest of that and not having Javier and Jorge.
No, yeah, there's Javier right
there he
there.
is.
Look.
Our new
He's the
secretary.
secretary.
Okay.
Is
I
our new
nominate-
secretary.
I nominate Javier.
That's what I get for being late.
That's what you get for being late.
Don't ever be late.
I second, motion passes.
So really quickly, let the record reflect the presence of Mr. Javier Danda here joining us in the
Thank you,
meeting.
David.
Albeit late.
Just a couple minutes.
Yeah. So Javier, your name has been thrown out there to be our secretary for our subcommittee.
Secretary.
Yeah, that means you're gonna take notes.
He's chair, sub-chair.
And secretary.
No. I don't take good notes. I don't. Sylvia, you can do it, come on.
I honestly, Pancho, I honestly don't know how long I'm gonna be away.
I'll do it.
Hector will.
If I
I
can.
would if it were any other,
Can-
for any other reason.
Somebody
Because-
else that's not here.
Can he chair
No.
the, can he do
How about
secretary?
Jorge?
How about Jorge Gonzalez?
can't chair,
Yeah.
Right.
so you can.
So,
do it.
with the interest of mine again, because the other two individuals are not here, I mean, how are they gonna really take notes? And
Can he serve as
Mhm.
the
Secretary,
secretary?
Yeah,
for this committee?
absolutely.
Okay.
Mhm.
There you
Well,
go.
we need a motion.
I'll
I
make
so
the
move.
motion.
Second.
Okay.
That'd be second.
All those in favor?
Aye.
Okay, motion carries. Hector is our secretary. Okay, moving on to item 8, discussion with possible action of roles and responsibilities of the bond referendum health and wellness subcommittee and any other matters incident thereto.
So if you would allow me, I'll jump in really quickly here to provide the timeline as to the subsequent meetings. Sorry, this is Richard Chamberlain, for the record. That the following meeting will be held on November 14th, which is next Thursday at 12 p.m. here at the Laredo Public Health Department conference room, with the third meeting held on Tuesday, November 19th, 2024 at 12 p.m. here at the Laredo Public Health Conference Room. If I-
No one's the third one?
The third one is Tuesday, November 19th. Should we need an additional meeting after that, of course, we are at the mercy of the committee members with your schedules and your request to schedule a subsequent meeting. During the first meeting, we will tackle the public health topic, which the mayor did want us to discuss the pediatric hospital, and we will be putting in information. We will be adding to that presentation the upgrades of our public health infrastructure, which includes this building as well. So that would be the primary topics that would be discussed for the November 14th, which could unravel itself, and we do have a 2-hour timestamp for that date, but if we needed to go longer, we can definitely go longer. For November 19th, we do have a presentation that will be provided by Ms. Tina Martinez with Community Development for the project for upgrades, which is the Hamilton Hotel, for our senior living population, and then we do have our HR director who will be providing an additional presentation then on the 19th regarding would you remind me, Linda, the topic of conversation?
It's on the liability, the retirement liability.
Unfunded liabilities, there we go, thank you, I appreciate that. And so that is the timeline that we have for this specific committee. Just wanted to make sure that you all are very much aware of those topics of discussion. If there's any additional topics of discussion, there was a motion for you all to add those in today, so we can prepare that for the group. I will ask Mr. Mata to provide an update on the bond referendum timeline as well.
So our first bond referendum main committee meeting is going to be on Tuesday, November 12th, that's next week, at 17:30 hours.
Yes.
No, this is for the subcommittee, but that is for the bond committee.
What is that? Which ones involve us?
The bond, you can definitely join the committee.
Yes, you can join, you're welcome to be part of that main committee, but those that are the chair and obviously the mayor appointee who's going to be chair for the entire committee, but all bond chairs are going to be asked to go to the big one, yes. Everyone else is certainly welcome to come.
And that is gonna be on.
The first one's gonna be on the 12th.
The 12th. Our subcommittee meeting for
City
health and
Hall.
wellness will meet on
The 14th.
the 14th.
Yes.
So unfortunately, there won't be any contributions from this committee to the meeting on the 12th, since we are just establishing roles and responsibilities during this meeting. But the subsequent meeting will be held on the 14th for health and wellness, and on the 19th for health and wellness, and those will definitely be put into the subsequent bond committee meeting,
Yes.
which is when?
12, once a month.
Once a month. So for December, there'll definitely
So
be contributions from this
Tuesdays.
committee to the bond committee meeting.
And ours will be held here at noon each time?
Yes, ma'am.
All right.
The next two times.
And should you only require any more, we are at the wishes of the committee.
So you folks are allowed to meet as often as you'd like, and it would behoove you to do that. You are a little behind from the rest of the committees. They've met at least 4 times already, so they're ready to.
4?
Yes, some committees have 3 times, so you have some catching up to do and listening to some of these presentations. And I believe safety is ready to bring their items to the main committee, so that's how. Again.
But luckily, we are working in the expedited fashion. That's why I did Thursday to Tuesday, so that way we can gather these thoughts and put that together. Well, the committee can.
And your meeting for November the 12th, where is that going to be?
It'll be at council chambers.
Okay.
Downstairs at City Hall.
Yes.
And it'll be at 17:30 hours, 5:30 p.m.
At 5:30. Thank you.
May I kindly inquire from the committee if there's any additional topics outside of the public health infrastructure, the healthcare associated pediatric hospital, Hamilton Hotel upgrades, and the unfunded liabilities for the health and wellness.
Could we explain the Hamilton Hotel upgrades, so we can understand it?
So, and that will be explained on the day that my presentation will be given, but part of the section that was allocated for health, and so if you go under the tab, maybe this will help a little bit. So under the tab of CMO, one of the last pages is part of this presentation that the city manager gave to the full bond committee. Health and wellness was given about $80 million to consider, so the subcommittee was given about $80 million to consider for these 3 projects that we're gonna present to you. The Hamilton Hotel was put into this subcommittee, because there are some, not so much, it's more of a rehabilitation, needed on the, it's more rehabilitation items that are needed for the Hamilton Hotel. So the city has owned this building, well, through a corporation. So the city owned the building through a corporation for the last maybe 23 years, 24 years. It was a tax credit project. That was the full renovation that was done back in 2001. Subsequently after that, in 2016, some restructuring of that corporation was done. Some minor improvements were done to the building. But now we are at a point where that corporation is gonna turn back the building to the city. The city has asked, the city is gonna ask through this bond referendum for funding to be able to to do a lot of rehabilitation, big ticket items that are needed. So that's what you're gonna hear. You're gonna hear what that project, a little bit of history on the project. I'm gonna provide you a little bit of the status of where they are, where it is right now is 165 units. Not all of them are rented. Some of the units do need major repair, but ultimately we are housing about 120 elderly folks there, right? Elderly households there. Now, the only correction I know in the presentation, it was that it's assisted living. It's not assisted living. It's an apartment complex. It is just age restricted. So you do have to be over 60 to qualify to live there. So it is age restricted, but that's just because of the component of how it was financed and how it was brought to the first repairs that were done. But it is unassisted living. There is no, you live there until you can live there, and if you can't live there, usually people transition from there to a nursing home or to a family member, but that is unassisted living. But we will provide you that information, and then as a subcommittee, you will determine if you want to include this and any of the items that are gonna be presented as the main presentation for the full bond committee. Because the full bond committee will have to determine out of all these sections, which projects will make it to the bond referendum. Did that give it a?
Yeah, you answered my question. Part of, I guess, what was, this is Pancho Abra. Part of what I was, I guess, asking that question, the reason, is that, we see so much in the city of Laredo. We've had the Alzheimer's Association has jumped up quite a bit for a number of years, and I think they're getting there. Unfortunately, my dad, when he died, had Alzheimer's, and I was just wondering if there's anything that we are going to address that discusses what the city could do or what we can look forward to with helping the Alzheimer's.
And I can chime in there if you'd allow me.
Go ahead, Deb, because I wanna kind of segue into Pancho's
And-
on another, you
And
have
so that
another.
would be a topic for discussion for enhancements and improvements to the public health infrastructure, which is something that will be discussed at a subsequent meeting. So in regards
Okay.
to programs, into expansion,
That's
into.
right.
So it's not.
I just thought it was
Mhm.
probably, it's not here.
It's not there.
And when I thought, maybe in the improvements for older people, I thought maybe that was it.
No,
All right,
the-
thank you.
The improvements will be more on the building.
Mhm.
So, or, go ahead.
Well, I was attracted to the committee because of the public health. I think this is gonna fit under wellness possibly. But under public health, the reason I was attracted, again to what I referenced earlier, that I know that we're in a community that is severely medically underserved. And the pediatric hospital certainly attracts me. I had a granddaughter who was severely diabetic, and all the health services that we needed to get for her, we had to go to San Antonio for. So pediatric is important, but we are also severely medically underserved. And COVID, I think, kind of really brought it to our attention. I'm curious about what, if anything, we're gonna be able to do to address that overarching issue. The medically underserved community, 30% of our folks who have no health insurance, the hospitals that are inundated. Are we gonna be able to address that?
So I will say that the bond referendum monies aren't able to be used for operational expenses. But what we can do with those funds is to expand on the infrastructure that would allow additional programs and services to come into the city of Laredo, and that they would have a space and a home to flourish and make those differences by ensuring that we are attacking those root causes of what is being experienced in Laredo, no longer being upstream but coming out of groundwater.
And I know Javier has another issue.
Yeah, no, my big issue is there again, Laredo is number one in Alzheimer's cases. There's no place for anybody to go to get service. They have to go to San Antonio. A lot of people can't afford to be going to San Antonio every 2 weeks because the treatments that they have right now, it's either every 2 weeks, and right now there's one that's once monthly. And people, if they can't afford to go and get treatment, I mean, all they're gonna do is they're gonna deteriorate. And right now, Leqembi, which is one of the treatments, is a stabilizer. It stabilizes them to hopefully, when we do get a cure, that hopefully we'll be able to reverse it. So we do need a lot of research, but there's nowhere to do this. And I've been talking to UT Health with the M&M acreage, and they're running out of space. Can we get another facility to be able to do that?
And that'll be more topic for discussion during the following meeting, because we do want to stick to the agenda
Just
items.
wanted to throw it out
Yeah.
of the top.
Yes.
And we do, and we'll have a lot to talk about at the upcoming meeting.
So really quickly, David Vasquez for the record. Can bond monies be used for workforce development?
No.
So what about, not workforce development, but more, addressing kind of some of the comments here, to attract, nothing like that.
So what can they be used for?
Equipment and brick and mortar, and
Brick and mortar.
So
Yeah.
brick and mortar
and equipment,
and equipment only.
But not
Okay.
for workforce.
not for
So you-
operational
So
costs.
you build it,
What-
but how do you staff it?
So what about, so advertising also and promotion, that falls under
Operations.
operations?
Operations.
Okay, so
That's
this is
where
also
UT
the
Health comes in. Hopefully UT Health can help us
Step in.
and get the workforce.
If I may, this
Yeah.
is responsible with the budget department, and that's gonna be our challenge, because the referendum, basically, we're bonding out money. That bonding is gonna be financed, by the, property taxes. So anything that's M&O, anything that we build, is gonna have an impact on the M&O. Just because.
Can you define M&O?
Yes, and that is the challenging part that we have, because, we can only grow so much on property taxes. We have
What
a-
is
What's
M&O?
M&O?
operation.
Okay.
So we have two sides of the tax rate. We have a debt service, on the tax rate that goes to pay for all the debt that we have. And then we have the maintenance and operation. That's what pays for salaries, promotions, advertising, all of the, maintenance and operation costs. So the referendum is just the buildings and, brick and mortar items that we're purchasing. Now, because it gets approved, we need to have the funding to get it on the M&O side. So the other thing that I just wanna mention is, those numbers that you have in here in that page, $80 million, is not necessarily our capacity or what we wanna issue. There were numbers that were provided by different departments, and it's not a concrete number that, oh, this is 80 million that you have to work. As the committees are gonna look at the priorities for the funds, you're gonna establish what the priorities that we wanna take forward to the taxpayer for their vote. So yes, there is a challenge in building something that we might not be able to afford on the maintenance and operations.
And just for clarification too, Sylvia, the assisted living issue that you mentioned, it's just really a typo, because we're not planning on adding that to.
No, yeah, it was just a typo, so this is an unassisted living facility and will remain an assisted living facility.
Okay, good.
These are just gonna be renovation rehabilitation items that are needed to continue providing the low-income housing option for our elderly population.
Perfect, okay. And then one last thing I wanted to mention, where David, was actually, going to with a question that he had. We both serve on the Laredo Economic Development Corporation. We've had meetings within our health committee, and we've talked to, people, in the city as well. So we're having preliminary talks about creating a fund to be able to bring in specialist physicians to be able to address some of the issues that you all have brought up. But that is in a preliminary stage, and so that's one of the things that we're actually looking at. And I think that's the reason that you're kind of trying to ask if we would be able to use some of those funds for that, correct?
Yes, that's right.
Okay.
So that's the idea, right, is to attract talent, attract specialists. If you go to the doctor's office, why do you have long waits? Medically underserved, going back to Sylvia's point, why do you have to travel out of town to see a specialist? Because there's none here in Laredo. There is, right? There are no specialists, right? So we need more of those to reduce those out of town trips, and then also reduce the lines at and waits at your doctor's office, right? Right now, if you want to see a gastroenterologist here in Laredo, it's, I mean, last I heard, just to see Dr. Canales, it's a year wait. Yeah, go to San Antonio, I can see a gastroenterologist within a week. So those are the things, and salaries is not really, it's more just, there's a lot of pieces to it without taking too much time, but that was the whole point. Okay, so do we need to entertain a motion as far as anything with this?
So just
I
discussion.
did have an additional question regarding the unfunded liabilities. Is there any particular information that you have regarding the unfunded liabilities?
We have some reports, so we're talking about the fire and our city employees pension system, this is what we're talking about. We'll have some numbers for you, we'll have a presentation on what we should be at, what is the standard business operations that we need to have, and where we're at. And this is mainly coming from our consultant saying that the city needs to be at this amount and we're here. So this is what we're gonna present to this committee.
So, okay, with that, we'll move on to the next item, so we can run through this. We're at item number 9.
Well, 10.
Well, just to, because I know we kind of covered item 9 also,
Yeah.
but just to read it, discussion with possible action of the timeline of the bond referendum, health and wellness subcommittee, and any other matters incident thereto, which we're all on board with. Moving on to item 10, discussion with possible action on the selection of the location, date, and time for the next bond referendum health and wellness subcommittee meeting, and any other matters incident thereto.
And I did provide times and locations just to set that, but if the committee wants to change it to another venue, we just have to make sure that there is recording and audio properties there. But we are able to make those accommodations, but I know we are already set in stone and ready to move quickly here at
Yes.
Public Health.
For your benefit, it was November 14th.
Yeah, we've already got my time.
Yes. Any discussion? Okay.
Regarding that issue?
Regarding, yeah, location, time, dates.
Do you need a formal motion to approve those dates and time?
I think that would be best.
Okay, we'll entertain a motion.
So
A second.
Alright, second from Sylvia, and any discussion? No? All those in favor?
Alright.
Okay, motion carries.
Done.
Done. Alright, with that said, we are going to adjourn this meeting unless there's
We have one.
Just a couple more housekeeping things that I'd like to alert to the tabs on your folders. So, if you, obviously that first page, you do have all the bond committee subgroups, the contact information. You also have on that binder, my business card, and anything that, any help that you guys feel that you need or any questions that needs to be answered, you know, feel free to contact any one of us. The first tab is your timetable, okay? And what's important about the timetable is that we are hoping to get at least your portion by February. We have to present it to the main bond committee, our selections, so that way we can have enough time.
By when?
February of this coming year. So it's coming up pretty soon.
So as an example, like for November, for next Tuesday's meeting, public safety is already gonna present their findings. So then that means that by December, there's probably gonna be one of the other committees. So we really only we'll have January or February but we should be able to present all that to them.
Correct. Thank you for that. Also,
I have a question.
Go ahead.
So, real quick, having said that, and the fact that we're kind of a little bit behind schedule, what is your opinion? I'm asking, you know, our city leaders right here. Should we add any more meetings to what's already been proposed, or do the meetings that we have are gonna, you know, be appropriate, you know, when we're considering time to be able to have a presentation and get everything done
always
by
add.
February?
You can always have meetings.
You can meet every day if you want to. So.
I think in our next meeting, once you hear the first presentation, you'll get a sense of, do you want the meetings to be longer? Do you want them to be at another time? Do you wanna come back, come back another day?
You wanna take a deeper dive into what we'll share at the first meeting?
I think this is a good starting point. I've gone to the other board meetings, bond meetings, subcommittees, and that's how they started. They started with at least 2 meetings, and then from there, they pivot or they added or,
Very good. Perfect, that answers my question.
Right, and that second tab, the CMO, City Manager's Office, that second tab is that first presentation he gave during our first meeting when we brought you all together. So, and it lays out important information as well, so please take time to review that when you get a chance. Also, the PIO tab, the PIO is Public Information Officer. It'll give the contact information for the PIO, any assistance whenever you guys get ready to put out any information, do's and don'ts, and speaking with the public. So take some time to go over that. The next tab is the legal tab. It talks about the Roberts rules of order, do's and don'ts within the meeting. Okay. Now for the secretary, as far as the minutes, so the main things that you need to worry about is the call to order time, the roll call, any motions that are brought, and the adjourn time. Okay, so those are the main things to report. So it's not like you have to write the whole meeting.
So those are the 4 more important.
Yes, call to order, the roll call, any motions, and the adjourn, time adjourn.
And these meetings are recorded and placed on YouTube, and YouTube has a nice little button that you could transcribe, and you can clean up that from there.
Now, there is a web link, was it provided to, Dr. Chamberlain, if you can provide, were you copied on that email that Mr. Esparza shared on the link to the,
I can push that out to everybody.
So push it out to everyone so that you folks can get the opportunity to see some of those videos of how some of those committees went down, and the minutes and all that. It's got a lot of information there.
If you log into the City of Laredo main web page, we have a banner that runs across. Right there it has a circle that says bond referendum. That'll take you directly to the bond referendum, and it has 4 different committees. If you select one of those committees, it will have the agenda online. We're working on putting the presentations in there, and it also has a link to the videos that are being recorded for review.
Okay. Another important piece of document there on the legal tab, if you go to page 3, it talks about the Texas Opens Meeting Act. Okay, and it was discussed a little bit during the initial presentation of the CMO. Don't engage more than 4 in conversations outside of discussing issues here. And that's all I have to say on that one.
Repeat that one, please.
So if you're going to start a chat,
Here.
yes. So for
Or
this
outside.
outside.
No, don't put it on
Yeah.
Facebook, don't
Only
put it on
only
Facebook.
3,
Yeah.
no more.
Among you guys, no more
No
than
more than
3.
4.
Smart, just keep it here.
Right.
Yes.
If you're gonna do a chat just about to discuss about when you're gonna meet, stuff like that, you guys are okay. But the minute you start engaging in, oh yeah, what do you think about this item, and don't engage in that. All right. So that's an important tab to go over. And bond counsel, you have bond counsel information, and I guess touches a little bit more on the timeline, and co-bond counsel as well. Do's and don'ts, questions that you might have on the municipal bonds. And this folders, this binders for yours to keep. Bring it to every meeting, and notes. Again, any questions, we will put both bond counsel and co-bond counsel and the financial consultant before you, this, coming Tuesday. And after that, every month as we meet, we'll invite them so that if you have any more questions concerning those, items, then we can certainly address them.
As the additional city executives that have been present in other meetings, is there a specific timeline as to when minutes are required to be posted?
I'm sorry?
Is there a specific timeline as to when minutes are required to be posted?
Yeah, well.
ASAP?
Yeah, ASAP. ASAP.
You don't need,
But you do need to post 72 hours before you have a meeting.
But basically these minutes that he's taking right now,
but the
right?
minutes need to be approved by the subcommittee?
Yes.
Oh, after the next
Okay.
meeting?
Yeah,
No,
so
after
they
the
should
next
be, so they should be ready at least for the next meeting.
By next
By the next
Thursday
meeting, so then it's added to the agenda.
for approval and
for
then they can be
approval.
posted.
Mhm.
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 Go ahead.
Any other discussion, any other questions?
Motion for adjournment?
Yeah, take a motion to adjourn.
Second.
Who,
So moved.
First.
Who's first? Lupita.
Lupita?
Oh, yes.
So moved, and she's second.
Okay,
Okay.
there you go. Alright, all those in favor?
Thank you.
Alright, motion carries.
All right, lunch, 12:45.
Time to